Hello, this is Dr. Ahmed, and I'm going to talk about an interesting topic. It's about animal bite, like a dog bite, cat bite, but specifically on the cat bite. During this coronas, a lot of people having a cat as a pet, more compared to the other years. We all grew up with cats since our childhood, either as a pet or an imaginary cat like Cat in the Hat in Dr. Seuss, or Mr. Garfield and his girlfriend Arlene, or Cheshire Cat of Alice in Wonderland. It is not just us that love the cats. For thousands of years, cat has been loved, worshipped, and sometimes hated. Just the same way the Egyptian Coptics loved their cats, and there is some idea is that they used to call the cat Mew. I don't know. Maybe it's true. That has become Caddy in Turkish language. And ultimately we have cat. So, he's been for a while. Cat has been with us and evolved with time. According to Jewish legend, Prophet Adams, the first person in the world, had a cat as a pet. We all know about Prophet Muhammad's love for cat, and the name of the cat was Muazza or something like that. There were some bad times for cat too. Almost 600 years ago in Europe, cat was thought to be a bad thing. It carries disease and it is bad luck. It is evil. You're not allowed to make a picture of cat doesn't look like a devil. In Belgium, there is an occasion called Festival of Cat. 600 years ago, it was a bad day for the cat. On that day, they used to take a cat on the top of the church and throw the cat out through the bell tower. And they used to die. It was a major festival. Thing has changed. They don't do it anymore. That festival of cat is very joyous occasion now, with parades and throwing toys for the kids. Irrespective of cuteness of the cat, which was domesticated approximately 7,000 years ago in China, cat still has the basic instincts of hunting, has retractable claws and very good hearing and the vision, and they have vertical pupil as we see in other cat species like a tiger, which is very good for vision. Domesticated cats are usually pretty docile and friendly. Sometimes it can be very aggressive and attack you or bite you. Some of the situation may be, what is the fear? That's natural for any animal, especially some animal like cat or tiger. Then they may be asking for attention or maybe annoyed from some things. Cat also can get depressed like human being. They also have a pain as they get older. Sometimes they may have osteoarthritis or rheumatoid arthritis. All can cause pain and discomfort, especially when you're trying to handle them or just trying to assert the basic dominance that cat has. If you try to think about how much problem this animal bite can cause, that is almost 1% of all ear visits. 90% of them are from the dog and 10% from the cat. Factors that will make you think about the complication from the bites is if you have some sort of immune compromised status, like even diabetes mellitus. If you have a bite in the hand or at the foot, that puts you at high risk for infection. Compared to the dog bite, cat bites are deep and very sharp, and it can get into the joints and the bones. So that's a big problem. And after you have a bite, it will take approximately 12 hours before you will see some problems like redness or pain or something. And you have to be always careful if you have a cat bite, because it is usually more serious than the dog bite. You may be thinking what kind of infection we can get from a cat bite. Multiple bacteria can cause infection. Some of the skin flora that exist, sometimes that can give some of infection when skin is punctured. Other than that, few bacteria comes from the saliva of the cat. One is a Pasteurella species, which is 75% of the cases. Then Caprocytophago species, which can be fatal in somebody who doesn't have a spleen or has a liver disease or alcoholic. So that has to be taken in consideration when you are seeing some patient or a person. Or people who has a issue with a splenia should ask for physician advice quicker than other people. Then is Bartonella species. Usually it has a longer incubation period. It's between 7 to 14 days. So you may have infection after that long period. Then has the anaerobes like Bacteroides, Fusobacterium, etc. If you do a culture of an infection or a bite, you will usually grow 5 different kind of bacteria. So you have to be able to choose an antibiotic which will cover all 5 of them. So what can you do at home after you have a cat bite? First of all, you wash it with the soap and water and flush out the bacteria as much as possible. You put a pressure dressing or put a cloth, it's a clean cloth, to stop the bleeding if it is bleeding. And you may apply some over-the-counter antibiotic cream and keep it clean. If you watch for infection, the way you know it is getting infected is that you will have a fever, there will be redness, and you will feel some pain. There's over-the-counter antibiotic available they call povidone iodine, which is a swab that you can buy, and it is good for rabies too. Now you feel that it's not getting better, it is getting red and more painful. Then you'll go and see a doctor. He will check for an infection or how deep is that bite. If he finds that there is a tenderness and redness and feels that this is a cellulitis, he will give you some antibiotic. If it is a very deep wound or have the crepitus, when you put a pressure, you hear a crackling noise. that is serious. And at that time, you may have to see a surgeon to see what to do. You don't really do any investigation or blood work if you don't need it at all. But if you have a bite on the scalp of somebody under age 3, they should get a CAT scan or MRI to make sure that there is no osteomyelitis. Usually, if there is a cat bite, an open area, surgeon usually doesn't put a suture or close it, and they let it heal from inside. Unless it is on the face, then you can do the sutures only for cosmetic reasons. Antibiotic that we choose usually is augmentin, which is #1 choice. And if you're allergic to penicillin, then you have multiple choices, like a doxycycline, Bactrim, or Cipro, along with Flagyl or clindamycin to give anaerobic coverage. Usually antibiotic is continued for 5 to 7 days or sometimes 5 to 14 days depending on the infection. You call a surgeon if it is very deep, it is an immunocompromised person, and you perceive a crepitus or wound in the hand or the face, and they have to go and dig out and get all the bad tissues out. To sum up, as I told you earlier, that in last 2 years the number of pet has gone up, so you expect more animal bites. And there is approximately 60 million cats are living in the home, and there is almost 66,000 cat bite per year that ends up in an emergency room. And I'm sure there's many more cat bites gets unreported because it gets better, or goes to primary care physician and they'll give you some antibiotic and get better. Is there anything you can do to prevent this? Yes, you can do a few things. First of all, you have to be careful and not lose the understanding that although this is a domesticated animal, but they have not lost their instinct completely. Everybody should have a tetanus vaccine, and for the pet, rabies vaccine is important to have. And povidone iodine lotion is a good thing to take or clean your wound with, as it will help with your rabies infection. Thank you.